Hello everyone, I'm Brian Christie. On today's program, we're discussing what you need to know if you're considering any type of facial rejuvenation. My first guest is Dr. Bruce Chisholm. Dr. Chisholm, known as the facelift specialist. Welcome to the program, Doc.
Thank you, Brian.
Nice to have you here. What does the public look for in a surgeon?
Well, what the public should look for in a surgeon is what we consider the gold standard. And the gold standard is considered to be, you want to make sure your surgeon's board certified. First of all, make sure they're a surgeon. Second of all, that they're board certified. The second thing you want to look for, the board certification is obvious. The second thing you want to look for is, are they on staff at a hospital? That's a little bit more obscure, but the reason it's so important is when you're on staff at your local hospital, you're peer reviewed. All your peers check you out, say you're qualified, and they do it every 2 years. And so you must reprove yourself every 2 years for what you do. For instance, I'm on at Eisenhower Medical Center, and I have full privileges in, say, facelifts. I can admit you, do a facelift, all that. That's a very high gold standard. It's difficult to achieve, so it's what we consider one of the three. The first two are very important, and that's easy to check out. You just ask your surgeon, you're board certified, are you on staff at this local hospital that's in your community? The third one is a little bit harder to figure out if you're a patient, and that's experience. And that's, you want to see the physician's, the surgeon's results. You want to check out the community, you want to ask people, you want to see the facelift results. You want to see a book of pictures, you want to see some of his patients he did 5 years ago, 2 years ago, 6 months ago, 6 days ago. And those are the three things we look, that's what we're considered the most important.
Now, is that the only thing you do, facelifts?
No, I do a lot. I do pretty much everything. But I've been doing it for about 20 years, and I love faces. It's what I love. People talk about plastic surgery as if it's an art, and it really is. There's a lot of technical skill. The training is forever in becoming, refining your surgical skills, but you're either good or you're not in the artistic sense of it. And I just love faces. I never get bored. I do facelifts every single day, Monday through Friday. And I love it every day. And so 20 years later, it's what I concentrate on the most. Again, it's not everything in my practice, but pretty much the face is what I love.
How important is that, the frequency at which you do it?
Boy, it's like anything else in life. Where I live in the Coachella Valley, for instance, golf, the more you play, the better you get. And it's the same thing with facelifts or whatever. And a facelift includes their face, brow, eyes, skin, lines, skin rejuvenation, all those things. The more you do it, the more experience you get, and the easier it gets, and the better you get at it. I think we all know that. It's true of everything we do in life. People have gifts, and it's just wonderful if you can find out what your gift is. And then it's even more wonderful if you get to do it. And then you get even better at it the more you do.
Well, you're known as the facelift specialist, so why the face for you?
Well, it's hard to say why you love something, but it just intrigues me. It's what people see. When they look at you, it's what they're talking to you. They're looking in your eyes. They're judging you. When you look at someone across the room, they see your face. It's what that's how they identify you. And I love it. When you look at a face, people look at a face, they see things very differently. I see things very differently than most. I look at you and I think of relationships. I look at the shape. I look at the support. A lot of people say, oh, you've got lines, blah, blah. I look at lines, obviously, but I look at everything. I look at the shape and size of the cheeks, the shape and size of the brow, the eyes, the eyelids, the nose, and I like to put it all together. It's a lot of fun.
Correct me if I'm wrong, but yeah. From what I understand, you have done more facelifts. In fact, you do more facelifts in a month than some people do in 6 months.
Yeah, oh, no question. Yeah, there's several reasons for that. A, we've talked about, I love it. It's what I concentrate on. I am known as the facelift guy. And secondly, I live in an area where people need facelifts. So I have to say part of it's that too. So a combination of it has afforded me the privilege of getting a lot of experience and just getting what I think is quite good at doing the facelift procedure. And that's really the reason why I do a lot of facelifts.
I think a lot of people would like to know about facelifts. What happens to the face? As you age, what is the process here?
It's so interesting. People talk about the facelift aging process if you wake up one day and it starts. Absolutely incorrect. It starts the day you start. It's just that you look great until a certain age. Matter of fact, everybody looks great their whole life, and everybody has a different concept of beauty and what they want. But people start to notice in the late 20s a couple of lines around their eyes. It's not time to do something. You still look great. In the early 30s, patients tend to look more changes. There's a little bit of sag, not bad. Everybody looks good. A little bit of laxing in the neck. You still look great. But early 30s, middle 30s, late 30s, patients tend to do little things, little fillers and little lines, skin rejuvenation, non-ablative treatments. 40 is a big change. It really is. And anybody will tell you that. When you hit 40, your body changes and your face changes. And the two big things that occur is you lose support. You lose support everywhere, but it's visible in the face. Your face starts to deflate. Not the bones, just the soft tissue, the skin, the support of the skin, the tissue underneath the skin, and all the support mechanisms. And you get a little laxity. So the combination of the two is what people see as you're getting, oh, there's a 40-year-old. Oh, that person must be in their 50s. Oh, that person looks like they're in their 60s. It's an instant recognition of the collapse and the loss of support in the face, and then the lines and the sun damage, the brown spots, combination of all the above.
So you say you look at the center of the face, and I would think that includes the brows and the eyes, and
Yes.
so that's a real big deal.
Oh, sure. You know, I think of it like an interior designer. If I'm the interior designer and I walk into a room, I don't look at the vase on the table. I'm looking at the room. I really do. When I look at you, I look at everything. I'm looking at your hair. I'm looking at your hairline. I'm looking at the quality of your hair. I'm looking at your ears, because they change. Your hair changes. Everybody knows that, particularly us guys. Right. Your forehead changes. It drops. It loses its support. We all know our eyelids change, and that bothers a lot of people. The part that's missed most in facelifts is the mid-face collapses, and it collapses on everybody. It really does. It collapses on some more than others, but it does collapse on everybody. It's the most frequently undertreated and improperly treated area during a facelift, and it's a shame because it's the best area to really rejuvenate youth. And I look at the jowls, I look at the neck, and I see it instantly. And I walk in, right away I say, okay, this is what's wrong, this is what we're going to do. It doesn't mean it's what you're going to do. It's a choice. It's a discussion between the physician and the patient, and what bothers you, here's what we can do, where would you like to start?
Now, Doc, you say you just don't pull, you actually reposition.
That's correct. Facelifts, historically, over the last 20 years, and before then, were pulling procedures. People weren't bad, they weren't doing the wrong thing, it's just the way it was. People were not identifying the aging process. Unfortunately, it's still the most common facelift today. I don't consider it wrong, it's just not the best facelift.
Is that still going on today?
Yeah, a lot. Most facelifts are still done that way today because the facelift to restore a face back to its youthful look, like you looked 10, 15, even sometimes 20 years ago, is a little more advanced, a little more technical, and you need a lot of experience. You're not going to pick it up in your first 2, 3, 4, 500 facelifts. You're going to pick it up in your thousands. And that's what happened to me. It really came to me about 5 years ago, and I was able to take all the techniques I've used over the 20 years and develop it into where we're at today. The beauty of it is we don't take things out anymore. We reposition everything. We restore it. We resupport it. Restore the tension. It looks better, it lasts longer, and it looks more like you. It's the biggest change in facelifting in the last 20 years.
So is that really the key to a natural-looking facelift?
The key to a natural-looking facelift is to make you look like you used to. And it's as simple as that sounds. I always say to a patient, you know, did you ever look pulled? Did you ever look stretched? You probably looked great when you were 30 and you didn't look pulled or stretched. Right. It's not the way a face is supposed to look. A face is supposed to look fuller, supported, restored tension. We do lose tension, so we have to restore some tension through the facelift process, but we also have to take the structures that were there, not remove them like we used to do, not just pull them like we used to do, but place them back where they came from and support them in that position, and then you look like you did 10 years ago instead of like you never looked.
I guess a lot of people would like to know how you evaluate a patient.
Well, when I meet the patient, the very first question I ask is, what bothers you? Because I want to know. I see things, and I know what's wrong, but it's not always what bothers them. So my job is to educate and address their concerns. And that's the most important thing. Listen to the patient. Let them tell you what's wrong, what bothers them, and then we can have a discussion, and then we'll formulate a treatment plan based on their desires and what's available. How I started is I start from the top and I work down.
So you start with the brows.
I start with the brows.
Right.
And I look at the brows, I look at the hairline, I look how the brows relate to the eyes and the eyelids, and you know, your face is one thing. It's not little compartments. Right. So when you see these treatments that treat just an area, well, it's like changing just the curtains in a room and forgetting about the carpet.
It's a canvas.
It's a canvas,
yeah.
And you want to look at it all. So the brows collapse just like the rest of our face. Some people, they collapse more than others. It depends on the underlying structures and your genetics and such. So what I look at is the level of the brows, how it relates to the eyes, the fullness and the support. And if the brows are a little bit lower, a little heavier, a little droopier, we raise them. The beautiful thing about brow lifts now is I do not use the techniques I used 10 years ago, which was a big surgery, open you up, a big incision. We now use incisions literally millimeters long, no excision of scalp, no excision of hair. And probably the biggest beauty for people is everybody has seen that look of the overdone brow lift, the deer in the headlight look, and we all hate that. That does not happen with the endoscopic technique. That happens with the older techniques. And
so this is not an endoscopic brow lift?
No, this isn't. The way I do it is endoscopic,
okay.
but the one that's overdone is not.
As far as the brow is concerned, what about men?
The male brow is different than the female brow for many reasons. Our hairlines recede and our hair thins, so the procedures are a little more limited, but that's not so bad because men don't want their brows lifted as much as a female wants their brow. And lifting's a bad word. It really is, because we're not lifting the brow, we're restoring the brow. We're repositioning it back to where it came from and supporting it. So the male brow is a little more conservative, so we don't have any chance of overdoing it whatsoever and make you look like a male brow looks instead of more of a feminine brow. A feminine brow is prettier than a male brow, and it's supposed to be.
Yeah, because men don't want to, we don't want to look feminine, obviously.
Men generally want to look like they did 10 years ago.
Exactly.
They don't want to look like someone else. So we treated, the concepts are the same. We just a little more conservative. We back off a little bit. Techniques are slightly different. And a really nice predictable results, no chance of being overdone. Females, we do a brow lift, restore the level, restore the look, and again, the technique is such that it's not that big surgery that was there 8-10 years ago. It's a very gentle surgery, and it restores look to the brow. The thing about the brow is it's connected to your eyelids, and when you have heaviness on your upper eyelids, generally, both of them are important. It's really 9 out of 10 times. So if someone comes in and says, I don't like my upper eyelids, you're going to have to address that extra skin in their eyelids to rejuvenate them and resculpt the upper eyelid to make it look like it did 10 years ago. But in addition, you want to reposition the brow because one without the other doesn't quite look right. After I evaluate that, I tend to look at the lower eyelids. The lower eyelids, historically, have been a difficult area surgically because of the poor support of the lower eyelid. The key to a lower eyelid surgery is to remember that it's part of the face and restore the face with the lower eyelid. And that's the biggest change in lower eyelid surgery and in facelift surgery in the last 6 years. When we look at the lower eyelid surgery, we want to restore its youth, restore its beauty, restore its volume, its support. And we have to do that in conjunction with the face, the cheek, this area right here.
You're talking about bags under the eyes, and a lot of people have this problem. This is something that's pretty common, yes, especially in boomers, I would think.
Yes, especially in boomers. You know, it's one of the most common things people come in and say, I don't like the way my lower eyelids look. And the technique has evolved. It's changed so much, which when anything's changing so much, it means the last one didn't work that well. And you have to be careful with lower eyelids because it's the one area you have to really respect the function of the lower eyelid. You have to respect function everywhere, but really in the lower eyelid because there's not a lot of support. So we rejuvenate it, put the tone back, re-support it, and then we make the tissue around it, the cheeks, the nasolabial folds, and at the same time address the upper eyelids and the brow.
Do you actually add fat under the eyelids?
Sometimes. It depends. Everybody's different. Generally what we're doing in lower eyelid is we're repositioning the fat that's there. People have little pockets of fat. You don't want to take volume. You do not want to take volume out of the face. You want to reposition the volume that's there and maintain the support of the lower eyelid. You want to restore the tone of the skin, the volume in the area, often by adding fat. But that's just the first couple of millimeters of that area. You want to look down below it, just like you look in a room when you're going to redo a room, and look at what's around there because it's all changing. If you just do that little spot, generally you're not going to quite get to where the patient wants to be. You want to rejuvenate the mid-face. So that's the next part I look at. And the mid-face is where most people don't get what they want, either with a facelift or not.
Doc, I want to talk about those lines around the mouth and what happens and what you can do to help that. Let's take a break. We'll come back with Dr. Bruce Chisholm, the facelift specialist, right after this.
I wanted to look young. I wanted to feel young, although I felt young inside, but I didn't feel young when I looked in the mirror. I had friends that had had surgery with Dr. Chisholm, and they looked so lovely. They looked beautiful. They looked so natural. I never even thought they had anything done until they told me they did. And one friend of mine told me she went to 16 different doctors. And she said, go and you'll see, you'll go to Dr. Chisholm. Well, I didn't go to 16, but I came to the office and everybody was so very pleasant here and caring, and I had so many questions that I asked, and they answered things to me, and they put me at ease. As I look at these pictures, I'm amazed at how I looked. It's been quite a while since I had my surgery, and I'm so happy I had it done. it made me feel young inside and out. And I feel that I look natural. Doctor doesn't believe, I don't think he does, in pulling your face and making you look tight and unnatural. People really ask me, when they meet me, they ask me, what did I have done to my face? My face looks so good. Am I using some special cream? And I tell them, no. I said, I go to a special doctor. I've gone to a special doctor. And they ask who it is. And I'm so happy to tell them who I went to. And I know a few of them have come here and had their surgery done. I personally feel that Dr. Chisholm is an artist. He just doesn't give you a facelift. He gives you a lift. He makes you feel good. He makes you look good. He makes you look natural. And that was what I accomplished by going to Dr. Chisholm.
Brian Christie back here. We're talking to Dr. Bruce Chisholm, the facelift specialist, and we're talking about boomers. And boomers, of course, when people get to their 40s and 50s, all of a sudden their face starts to change, and they want to look younger. They want to look better. Yes. And you can actually make that happen. Yeah,
you know, when someone comes into me, they want to look like they did. They want to turn the clock back about 10 years. I'd say the number one reason, other than a wedding or a high school reunion, is that they look in the mirror and they say, I feel younger than that. I feel younger. I feel like I did when I was 27 or 32, but maybe I look 55. And it's not that they really hate it. They just want to look a little bit more like they feel. That's probably the number one reason people come in. And the weddings are big too, high school reunions. But
of course, but I would think it's not just boomers in 40s and 50s. Right. You're treating people in their 60s and 70s and sometimes 80s, right?
Absolutely. You know, people are healthier, they're living longer, and people want to look good. They want to just look good. They want to look good for their age. The key to a facelift, in any surgery, is to make someone look really good for their age. That is the absolute key. You don't want to try to turn it back 30 years. You don't want to make someone who's 67, or try to make someone look 37. You want to make them look great for 67. And when you do that, you'll accomplish exactly what they want, and they'll love it.
Doctors, there's facelifts and there's full facelifts. What defines a full facelift?
Well, you know, it's a bit of semantics, but in my practice, a full facelift means I address the whole thing, all the way from the collarbones to the top of your head. And so we're going to get rid of the jowls. We're going to get rid of all the laxity in the neck. We're going to contour it all back to where it was, sculpt it out with liposuction. We're going to restore the whole mid-face the whole mid area of your face, which is so critical. People just don't address that in facelifts, and what happens is it doesn't look right. Then we're going to make sure we address your upper eyes, take out the make it look like it used to, rejuvenate it, take out any excess, rejuvenate your lower eyelid, rejuvenate your brow, and rejuvenate your skin. It's the biggest part of your face.
You know, a lot of people are talking about fillers nowadays. Yes. They're filling in everything. What are your thoughts on that?
Well, I use fillers on everybody in their appropriate use. And so we need fillers because for lines and volume and such like that. The problem with fillers by themselves, although a nice technique, is that you're really patching it. In other words, if you just fill a line or say the nasolabial folds, then you just have filler in your nasolabial folds. If there's other issues going on, it's not going to be that effective. You really need to look at the area and address all the changes in the region. It's not to say that you can't put filler in the nasolabial fold. It's a quick, simple patch, but it's not going to make most people get where they want to get.
You know, I promised our audience before the break we were going to talk about nasolabial folds, and maybe you could address that right now.
You know, the nasolabial fold are these guys right here. Yeah. And it's not just a fold. It's always there. You have it when you're 20 and 30 and 40. What happens to the face is it collapses. And so the cheeks come down, the skin folds over, and everything gets thinner. So if you're really going to treat the nasolabial fold for what's going on, you want to re-support the cheek, put the volume back, and put a little bit of filler in the nasolabial fold. You're not going to accomplish success by just filling up the folds. You see that when you see a 55-year-old lady who's had a lot of filler placed around her mouth. What you really see is a 55-year-old lady with a lot of filler around her mouth. You don't see someone that looks 10 years younger. You see someone that's tried something and it didn't quite get the effect they wanted. You really want to look at it like art. Restore the whole area back to where it was. Don't change things that much in one spot.
So, Doc, how do you stay on top of it all?
Well, you know, to stay on top of it, it's a lot of stuff, and it's enjoyable. The way I do it is, I'm fortunate enough to do a lot of this. So you learn every day. Every day is a learning experience for all of us, and I love it. I go to work, I'm happy, I'm learning, but then you share with your peers, and you go to meetings, and you go to conferences, and you lecture at conferences, and you listen to other people's lectures at conferences. You take home a little pearl all the time. You talk to your friends around the country. Hey, what are you doing for this now? What's new? It's very exciting, and it's fun. It's fun to keep up on what's new.
You do have a process, though, that people go through when they first come to you. What is that process?
When they first come to me, they come to the office, and we do a consultation, initial consultation. And again, the very first thing I say is, what bothers you? Because I don't know. I'm not sure. I know what I see. They'll tell me, and then we'll walk through what bothers them, what the best treatment is for that, what's the most effective treatment, and then we'll work through some of the alternatives that might be available. And you know, there's a lot of choices out there, a lot of it based on time, how much time they have to heal, stuff like that. So it really depends on what the patient wants, and we discuss it, come up with a list of problems, and based on the list of problems, we formulate a treatment plan.
Doc, what about the jowls in the neck?
Well, you know, the jowls in the neck, my practice, it's the #1 concern for ladies when they come in, all the way from the 30s to their 80s, and they hate it, particularly ladies, but men hate it too. Boy, I'll tell you, it's across the board. And it really throws your look off. And so a facelift has to get rid of the jowls in this area under the jawbone or the jaw. And so we want to make sure that the neck is really well repositioned back to where it was. The jowls are gone, but everything else is resupported and placed back where it came from. It's probably it is the most critical part of the facelift, although it's equaled by the mid part of the facelift. And so a facelift is going to address the neck all the way down to your collarbones, the jowls, and the mid-face.
What about the cords under your neck? What's happening there?
Well, the cords are a really important thing to a lot of people. It's part of the aging process. It's laxity of the muscle, laxity of the skin, et cetera, et cetera. I've been doing facelifts a long time, and I have an array of facelifts available to every patient. And we have a facelift. You can come in and say, I really hate the cords under my neck, and we can get rid of them for you. There's just no question about it. We can also improve them. The great thing about facelifts today, and particularly in my practice, having done them for so long, and I've done thousands and thousands of facelifts, when you get to that level, you can really offer the patient what they want. And when they come in and say, I don't like the cords, I don't like the laxity, I don't like the jowls, I don't like the fullness here, I'm no longer mystified by what will work for that patient. And even better than that, they get to make choices. In other words, they don't have to have a full facelift. They can say, you know, it bothers me, but I don't hate it. I'd like to just have a nice improvement. And you can give them a beautiful, nice improvement with just a very short minimum healing time. That's another great advancement in facelifts. There's not such thing as a facelift. When you get into the thousands and thousands of experience and decades of doing this, you really realize you can give the patient what they want. And that makes me happy, because they can come in and say, you know, I've got the time, let's get rid of it. Or they can come in and say, you know, I'm a very busy professional. I need to look a little better, but I don't have 2 weeks off or 3 weeks off, or I just have a couple of days off, and you can really give them what they want.
If there's a mistake that's going on in the world of surgeons, and I know you don't want to talk about somebody else, but what's going on?
Well, I wouldn't call it a mistake. Everybody notices a mistake. We all see the mistakes. But what surgeons are missing is they're not seeing the big picture. They're not seeing the whole face. They're looking at a jowl and saying, I can get rid of a jowl. The jowls are attached to your neck, and the same process that caused the jowls cause the laxity in your neck and cause your mid-face to collapse. You want to address all three. If you just pull here and you just pull here, you'll look like you just pulled there. You want to take the entire face, this whole area, and gently move it back up where it came from and restore the volume and support in the mid-face. That's what made you look young. That's what made it look balanced. It's funny, I remember years and years ago listening to lectures about balance and relationships in the face and thinking, oh, you know, I need to learn how to tighten first. And that was 20 years ago. The reality is, it is what's important. You need to restore the balance to the face, and it's what's missing in facelifts. They do not restore balance and volume, they just tighten. My experience has allowed me to learn how to restore the lost tension, but to restore the balance. And now when I look at a face, I want to rebalance your face, because a youthful face is balanced. And that's when you look across the room and say, I think she may be in her 50s, or he may be in his 60s or 40s. It's a balance. It's the way the relationship, the cheeks relate to the cheek. And it's biological as well. It's the way it's collapsing. So we surgically restore the look. And that's what's missing in facelifts today.
What about art and science? Do you feel like you're an artist?
It is both, no question. There's a lot of science. You go to school forever, and there's a lot of technical things you have to get correct. You just do. You have to know what you're doing. And dabbling in facelifts is not a good idea, just technically and on a scientific basis. On the art side, it is what it is. You either see it or you don't. And we all, you see the results of what a surgeon does. That's what they consider to be beautiful. That's what they consider to be youthful. That's what they think you should look like, because they're doing it time and time and time again. It's easy to judge a physician's results by looking at years and years and years of his results. You'll see what he likes. And that's the art, seeing it with your eye. And artists see things, and you either do or you don't. What
defines a great result in your hands? What do you see?
Boy, a great result for me, number one, is a happy patient who got what they wanted. Easy healing, quick, rapid, minimal bruising, minimum to no pain. But I want them to come in and say, I never thought I would look like this again. I feel good about myself. I got a vigor in my step. My husband loves it. My wife loves it. My friends love it. They think it just looks natural. They think it looks good. That's when I'm happy. I'm so comfortable with it. And they look like they did 10, 15, sometimes 20, but 10 to 15 years ago, and they feel comfortable with their look, and they're happy.
Final message, Doc. What do you want people to know about you, and how do they come to you for a consultation?
Well, I'm on campus at Eisenhower Medical Center in Rancho Mirage, which is in Palm Springs in the Coachella Valley, and facelifts are my passion. It's what I love to do. I've got the science, and I found my art, which is the face, and it's my canvas, and I enjoy it. I love going to work every day. I love making faces look pretty, and I, most of all, love finding out what someone wants and achieving that goal.
And making people happy.
Making people happy.
Yeah. Dr. Bruce Chisholm, we thank you so much for joining us today.
Thank you.
Appreciate it. See you next time.